Hi, this is Diane Silva with Remax on the Move, and I'm with Dr. Shawn Shapiro today in Portsmouth at 10 Vaughan Mall. And we have some questions for Dr. Shapiro. He is a chiropractor for the entire Seacoast area, and I'm going to ask him why he became a chiropractor.
Okay. Well, thanks again, guys. It was great to be involved in your first venture like this. So, a lot of people have a lot of reasons for what they do. Mine was based on the fact that I didn't think I was helping anybody in the world. And about the same time that I realized this, my grandmother got ill, and she didn't get ill. She actually had an elective surgery, a mitral valve replacement in her heart, and she went down to Brigham and Women's and was given really good care down there. But between her stay at Brigham and Women's and between moving to another hospital we won't mention, there was confusion with her medications, and they ended up giving her too much of something called Coumadin, which is a blood thinner, and she got a cut in her throat through dry air in the hospital and whatnot, and she stroked out, and she did not recover real well right away at all. In fact, she lost her ability to speak for a while, and it was kind of a tough time for everybody. So I started looking into the whole medical thing as something maybe that I could help with and change. And as I looked more into it, I realized that one person wasn't going to change that system. And then as I was talking to my mother in my grandmother's hospital room about that, she ended up one of the first things she said was why don't you go be a chiropractor? And I said, oh God, no, not a chiropractor. I don't even go to the chiropractor anymore. I only go when I'm in pain, blah, blah, blah. So I took it to heart and I looked it up, and the internet was in its infancy then, but it did have a lot of information about what chiropractic was, and it wasn't anything like I thought. It had nothing to do with pain. It had to do with function. And that really spoke to me. So I decided I was going to help people function better, and as a result, maybe be in less pain, and maybe as a result, live better lives. And that's what I've done for the last 14, 15 years now.
As a client myself, I have to admit that what Dr. Shapiro does is amazing. Is it mostly adjusting backs, or are you more into the whole person, like you're talking about also helping the whole human being, not necessarily one specific spot at a time?
Well, as you mature as a chiropractor and become more able to handle more modalities and things like that, you can add things to your tool bag to help people. And the two of the things that I've added are nutritional reflex training, testing, as well as I'm a certified clinical hypnotherapist now. So I do both of those in conjunction with the chiropractic, and we don't just adjust backs, we adjust legs, we adjust arms. We've added cold laser therapy to help with issues, believe it or not, related to nutrition, and it's actually helped a lot of people with scarring and stuff like that too.
So now you're doing massage too here?
We've always had massage therapists, for the last 15 years we've had massage therapists working for us. Yeah, so we have a lot of options that we try to give everybody, and we try to keep it affordable as well. So that's probably
key. So you don't have to have an injury to come here. You can do wellness care, in other words.
Yeah, well, I kind of I tell everybody to pump the brakes a little bit when they tell they're coming in for wellness care or maintenance, because you got to have something to maintain. If your car comes in and it's going, you're not coming in for maintenance. You're going in for the car to be fixed, and then you can maintain it. So there are things that we can do to restore the spine, maybe not to 100% of what it was when you were 12, 13 years old, but we can bring you back maybe 10 years in your progression to get you to a point where you have something worth maintaining, as opposed to just throwing on the scrap heap.
Such as putting orthotics in your shoes, maybe?
The orthotics have been a huge part of our practice for about 7 years now, and the reason for it is because one of the things that aggravated me the most was that patients would get well and maybe fall off their maintenance schedule, and then show up 6 months later with the same problem. And I was going to seminars or marketing seminars and things like that, where they tell you have to count on that as part of your revenue. And I said, well, that's true. It is part of my revenue, is that people show up 6 months later with the same problem. but I didn't want that money anymore. So
Yeah.
what we did was we found a company called Foot Levelers, which actually stabilizes the foot in a way that allows the pelvis to be stabilized. And that pelvic stabilization is key to keeping people healthy. It's key to taking the pressure off the frame. So we have people who have headaches. We have children who have bedwet that we just put the orthotics on, and because of the pressure that takes off their pelvis, they get a lot better.
Awesome.
Yeah.
Very good. A unique group came to Dr. Shapiro, the New England Legends Football League.
Oh gosh, yeah.
And I want to ask him how he could help this group of women, and why they needed him to begin with. How'd that come about?
Well, I will tell you this, that Legends Football League, while it's all women, is so brutal. I've never seen anything like it. They unfortunately the New England team folded because they had they had so many head injuries that they had to. But yeah, no, it was I would go in and I would adjust both teams and they would, it was a great experience. I've never adjusted so many people in tight spandex before, but we've all got to sacrifice for the good of others. So that's what I looked at it as.
I will say that Dr. Shapiro's office is like a revolving door in that people are constantly coming in. He adjusts you, you leave, another person. He's very busy. So make your appointment early if you're interested. I think we're all set here. Is there anything else you'd like to add?
No, I'm good. Thank you.
All right. Thank you for watching today's episode of Park Bench Portsmouth. I'm Diane Silva with RE/MAX on the Move, Hall of Fame member and extraordinary realtor if you need one. You can call me at 336-430-3397. Thanks very much for watching. Bye-bye.